Since October of 2022, there has been an Adderall shortage in particular. However, other stimulants as well have had problems such as Ritalin, extended release Adderall, and Vyvanse as well. And with this, there are some serious problems on the rise, meaning some people are going through having to go through withdrawal a lot more frequently. And another thing we're going to hit on as well with this, we're going to talk about the withdrawal, but also about the other problem, how these new pharmaceutical companies are creating different versions of Adderall. So we're going to be looking at the brand versus the generic, and it's great that there are companies making their versions of Adderall, which has 98% of the active ingredient, but what's happening is there's that like 2% where there's fillers in it and dyes, which can cause more side effects and the medication not being as effective for some. Now first, let's talk about the withdrawal. Now around 2 or 3 years ago, this actually happened to me, where when I was taking Adderall for ADHD, I couldn't get my medication filled. And if you're like me in this regard, if you're taking your dose as prescribed, obviously, one thing I always like to do toward the end of the month, and typically for me, there'd be days like weekends and stuff, I wouldn't really even be taking it. There'd be no need. But when I get toward the end of the month, typically I would try to kind of taper it just in case there'd be a problem that would happen. Unfortunately, 1 month that didn't happen and they ran out. And I was taking my medication every day as prescribed. I didn't have any left over, and I had to go through the withdrawal of it, and I couldn't get my medication for about a week and a half to 2 weeks. And it was not pleasant at all. It was near the holidays and whatnot, but I'm going to go through some of the problems with this. And at this time, there weren't all these new companies popping up making their versions of it, but that's not necessarily a good thing that other companies were. But let me go through what I find as being the hardest part of going through the detox from stimulants, or in my particular case, Adderall in general, and just what patients have reported as well to me about what they have gone through. Now, first and foremost, it's really going to depend on the dose you've been taking. Are you taking how long have you been taking your dose for? Have you been taking the stimulant or Adderall or Vyvanse for a couple of years? Have you taken it for just 3 or 4 months off and on? And another factor is it extended release or is it instant release? A lot of times people who take the extended release when it comes to the withdrawal have more problems getting off of it. I took the instant release, and for me at least, when I didn't have it for a week and a half, and I went a couple days before without it, so, which really no problems. But what I noticed after the 48-hour mark for me, and the most I really take in a day, I'll just tell you as well, was about, at most, the prescribed dose was like 40 milligrams total. That was a lot. I would typically take 20, maybe to 30 at most, because you can break them up, which makes it easier. Extended release, you really can't do that with. Now, what happened was around 48 hours afterwards, I did start to notice a withdrawal. And the biggest side effect for me was there was no nausea, no vomiting, or anything like that, but it was the fogginess, the brain fog and the forgetfulness. Those were the two biggest problems I noticed. And the forgetfulness it wasn't like it scared me, but it was more so I felt like my short-term memory was slightly affected by it. Like, for example, just setting down my keys and not remembering where I put them and whatnot. Just little things like that, which caused a little bit more irritability and a little bit more anxiety. But another thing was physical. It wasn't like hot or cold sweats, nothing like that. No really temperature swings, no numbness. But it was almost as if it was like a heaviness feeling, not like muscle aches like when you're sick, but like it felt like there was so much more resistance in my muscles to just get up and do anything, which leads to the next point, which was motivation. And everyone's different with when they start the withdrawal. Some people start from some patients starting within, honestly, 12 to 24 hours after taking their last dose of extended release or instant release. Everyone's different. Some people take higher doses. Some people take 30 milligrams twice a day, 60, which would be 60 milligrams total of instant release, or even extended release, 30 milligrams twice a day. But the physical, the body aches, and once again, it wasn't an aches, it was just like a heaviness, if that makes sense, a heaviness, which leads to the next point for me, which was the lack of motivation. So I remember this was like, so when the 48-hour mark hit, that's when I noticed that just extreme, it was just like extreme tiredness, no motivation, forgetfulness, brain fog. That's when all of that hit me. And that continued for around, after the 48-hour mark, around it was like 3 to 5 days. Luckily, it was when I went into a weekend so it was like so the good thing was like it was a Thursday, Thursday, Friday didn't have it, but didn't really have anything. Then Saturday, Sundays when it hit hard. But after about day 5 or 6 for me, I noticed motivation was starting to come back. But the problem was it was like, for example, picture this, and I know I'm kind of bouncing around everywhere, but picture you get out of bed, and if you have ADHD, your thoughts are sometimes everywhere. It's hard to complete a task. And now picture just not even being able to get out of bed because your motivation's not there. I just wanted to sit on my phone and watch videos, literally. That was the only stimulation, and then I just kind of wanted to lay there. But with that, what I can tell you will help you is, for example, after somebody gets a hip replacement or a knee replacement, they're within 24 hours, even earlier, trying to get you up and walking. Even though it's super uncomfortable and extremely painful, they try to do that so you have a decreased risk of clots. You start the healing process faster. I would encourage the same thing to people who, when you feel like that ton of bricks has hit you and you feel like you can't do anything. And this, once again, if you're not having really any physical symptoms, it's more that brain fog, just like you're not having flu-like symptoms. That's the thing. You're not having flu-like symptoms like with opioids or anything. But I encourage you to just get up and move around, because that'll start the process of getting the toxins out of your system and pushing it out a little bit faster. And it does each day get a little bit easier in that regard. But that lack of motivation was very tough. The good thing I can say about the withdrawal, I guess, from stimulants, the one good is you don't have to worry about potentially having seizures like from benzos or with alcohol. But that lack of motivation, and also sometimes with that, those nothing like suicidal thoughts, just with that anxiety thinking, am I ever going to get better? And then the interesting thing was, once that week and a half passed, I was starting to feel better and more clarity was coming back. But the short-term memory was still kind of scary. I'm not going to lie. That I noticed my memory still felt a little off. It was improving, but it still felt a little off. But finally, after a week and a half, literally, that's when they had the medication back in stock, which leads to the next point of this. So with the withdrawal, I don't want anyone to have to worry super hard about it. Yes, you'll be tired. It's going to be very hard to work. Tell your employer if this is happening to you. I mean, if you have a prescription for this, let them know. I mean, because this is something with there being a shortage, it's going to cause, unfortunately, a lot of lack of motivation, and there aren't a lot of over-the-counter things that are just going to help, that are just going to make this go away. You're just going to have to go through it if you don't have any in reserve at all, and you just have to stop it cold turkey. Now, what will help assist you get through the process a little bit faster, though, you'll still go through it, is making sure you're drinking plenty of water, making sure you're eating a nutrient-dense food. And I'll tell you, too, that's another thing. After the first 2 days and whatnot, at first I didn't want to eat at all. It was just, once again, lack of motivation. But then once I got past that first week, I wanted to eat everything. That was an interesting thing. Throughout the whole time of me taking my ADHD medication, I've never had any appetite suppressant problems, but I noticed the complete opposite when I didn't have the medication available to me. Also, the big thing I will say with it, as I stated with the example of like if you know, like how if somebody has a knee replacement, they try to get you up within 24 hours, even earlier sometimes. If you're gonna get out and drive, if first off, if you're alone, just try to walk around the place you live. I would not try to drive, because one thing I did notice as well, and I'm happy I wasn't driving, but when I was in a car, not motion sickness, but it was like that fogginess feeling would kind of cause like a quick brain zap to where you just kind of be like, it wasn't confusion, it was just kind of like, it was like a pause of your brain for a second, because there's so much, if you have ADHD going on, to where if you're not getting the medication, it can be so much stimulus to where you just kind of blank out completely. So I would try to avoid driving if you need to. I'm just happy I didn't with that. I don't think it would have been a problem, but still it's something you don't want to risk. And also, now, and once again, there's not much I can tell you about going through the withdrawal that's any remedies that are just going to completely take it away. But I will say caffeine, I know people will start going overboard with sugar and caffeine. I would limit your sugar intake and not eat a lot of sugar at first. But caffeine, if you drink like a cup of coffee a day and you can hold it down, maybe a cup and a half to 2 cups, but don't drink twice as much caffeine as you normally do, because that will cause your blood sugar to go up and down, and that will cause, you might have a little bit of relief, a little bit of energy, but once your blood sugar starts crashing from that caffeine, you're going to feel a lot worse. And I actually personally remember that. That was another thing that, like, I just felt like the crash was even worse from that. So be cautious with caffeine, drink it very moderately, and I would say just kind of sip on it throughout the day till around 4 in the afternoon. Obviously don't drink it at night, but you're going to be wanting to sleep. So it's going to be hard to get out of bed and whatnot, but try to just moderation with the caffeine. And now, an important part. When I finally did get my medication, and even like with patients, when they, if they've been through the shortage and whatnot, which most people have went through this at some point now, you're used to getting specific you have your brand name Adderall, you're used to getting your generic, like through Teva. That was the one that's common around here that, no issues with it ever. When the shortage happened, they started giving different generics, which was, in particular, it was like Sandoz, there was Epic and Lanet, which I think they're kind of the same thing. But when I was on Reddit, and I know don't completely trust Reddit, but you sometimes get the most honest reviews from it. And you know what I mean if you've been on Reddit before. You know what I mean on this. And I'm an RN saying this, but you got to really do your research that some of these generics, and I noticed this even with the Sandoz one in particular, I got that for a script a while back. This wasn't when I didn't have it, then I got my medication again. I had the same generic, but this was a little later when they switched from Teva to Sandoz, and I noticed, I felt like it was kind of working, but it didn't feel near as effective, and I did notice locked jaw, which was very interesting, and I'd never experienced that before, and I'm like, what is this? And I was like, I guess I'm just happy I have the medication, but yes, it has the same ingredients, but there are fillers in some of these generics. So if you're noticing side effects, check your bottles and see what, let's say you're like, man, I feel like my medication was working, 6 months ago. If you have your bottles and whatnot, go back to what you were prescribed, what the generic company was, and then you can call your pharmacy and ask them if they have that. You can call them and ask them. They might not tell you, but if you're frequently go to a pharmacy, they will let you know, because they have to answer questions like that, because you can let them know, hey, I was having side effects from this, that, and the other. But Sandoz can cause things like tight jaw. Epic can cause more anxiety and some GI problems. I got the Epic one time, and I will say I didn't have any constipation or diarrhea, but I did notice my stomach felt more heavy, like I wasn't digesting at the rate I normally do, and I felt maybe a little bit more backed up, but I was having some stomach aches. So if you are feeling like your medication isn't working near as effectively, check and see what the generic is that you're using right now. Because if it's been switched, because more than likely with this shortage, there's a lot of these new companies that are now making the medication, and there's specific guidelines they have to go through, which I'll link the video about this at the end of this if you want to check it out. These new companies are essentially now able to, they've manufactured it with there being a shortage, which is good, but the only problem though is they have the active ingredient in it, but there's these fillers and dyes they can put in it, which can make a difference to people in regards to even like psychologically. Like, let's say the medication you take tastes sweet, like like for example, the Tiva one has a sweet taste when you take it. Some of these other ones just taste bad, and it tastes like, and it like causes more, for example, reflux. Luckily, I don't really have problems with reflux, but it can cause more reflux as stated by patients and whatnot, and just having even like rebound, severe anxiety. And one person reported that one of the brands they gave them, and I'm not going to mention the brand name, caused some suicidal ideation. So please do look at that. But the main reason also I make this video is because this shortage, there will be updates every couple months saying, oh, we think we have it figured out. As of today, there's still a shortage in specific parts of the United States. It's easier to have access to, and a lot of times people are having to have a family member. Let's say you live like on the East or West Coast, you have a family member that lives in the Midwest. Sometimes people are having to have their medication sent to like where their parents live, and then they have to ship it out to you because there's just none around, like in the area they live in, to where they're having to do orders through their parents and whatnot, which leads me to this. If you have no access to your medication and your parents live, for example, let's say you live in Louisiana, I'm just throwing that out there, and let's say your parents live like in the Midwest and you don't have access to it, because that's a state that was having some severe problems being able to get their medication filled, their ADHD meds. Look at a pharmacy close to your parents, like at a CVS, and you can, if you need to, you can have your doctor send it to a pharmacy there, and then they can actually send the medication. They can actually do a order where they can ship it out to where you live. Because once again, it's up and down right now, but there are a lot of problems going on right now still with being able to get the medication. And I also have a feeling, even though they're keeping it really quiet right now, that unfortunately, I think some of these companies that are making this medication, there's going to be a lot coming out in regards to the side effects on this, because it's becoming more, it's a recurrent theme I'm noticing that, for example, for me, there are two, and I'll just give mine, that two generic brands that for me work personally, and that is Tiva and Epic/Lanet. Those ones, because they look very similar, and those are the ones that work the best for me. Sandoz did not work at all. I'm just going to be honest with you on that. But if you're noticing this, check that out. But also, last thing I'll leave you with, I know this is a little longer video. If you need to take, if you're toward the end of the month and you have a feeling, or you don't know if you're going to be able to get it refilled for a week, whatever your dose is, I would cut it in half, because typically you can fill your medication 2 days prior. So make sure you do call them. They're not going to think you're drug seeking or anything. It's just staying on top of it, because at least if they don't have it, you can start your process of letting your doctor know so they can send the script to a new pharmacy and whatnot, because it is a process with Adderall and whatnot, getting a new script. It doesn't work like a lot of these other medications, control medications. Doctors have to write completely new scripts. They can't just send that to a new pharmacy. But if you do that, a week or so in advance, and you've been taking your medication as prescribed, you should be okay cutting your dose in half to where you're still getting in your system, you're getting the effect, to where if you do have a problem, you'll still have, at least a week or so left in case there is a shortage. So by the time you do get it refilled, you might just have 1 day where you're not getting your medication, as opposed to like a week or week and a half. So do try to, if you have that feeling that could happen. And I'm not a doctor, I am an RN though, but I just wanted to let everyone know that to be very cautious right now in regards to if you get your script and whatnot, making sure you're looking at your bottle, looking at who actually, if it's a new generic you're taking, if you're feeling off, also making sure you're keeping your medication stored properly, because it's a medication right now, unfortunately, too, since there's a shortage. There's a lot more people trying to get it. So just be cautious in general with it. And also, just once again, if you have a prescription and whatnot for it, make sure in general that you recognize that if you do have to go without it, and I know it's different for everyone, it will be okay. Yes, you will withdrawal. It is hard, but it is doable. Okay, I've done it, been there, but just during this time, if you got to tell your employer with the shortage going on, just let them know, because it's one thing, we don't have any control over this, but yeah, that's your daily dose of mental health. I wanted to put that video out there. Like and subscribe. It was a very long video, I know. Leave a comment if you've had any problems with your ADHD medication, your Adderall, your Vyvanse in general, if you've had any problems getting it filled, or if you've gotten a new brand, or a new generic, and if you've had any problems with it. Because if you are, you're not the only one. If you want to leave a comment, do. That is your daily dose of mental health. I love you all. Have a great rest of the week.